Hospitals and clinics in Botswana have run out of essential medicines, leading to postponed surgeries and disrupted treatments for chronic conditions. Shortages listed by the country's health ministry include medicines and supplies for managing cancers, HIV treatments, and tuberculosis, among others. This crisis led to Botswana's president to declare a public health emergency. The shortage of essential medicines and equipment comes amid challenges with Botswana's medical supply chain and a global downturn in the diamond market. Botswana is one of the world's largest diamond producers, and the country's economy relies heavily on the diamond sector.
There's been a lot of problems regarding distribution of medicines around the country. And because of the economy that has slumped, we haven't been able to source medicines from wherever we source them, wherever the central medical stores used to source them. So there's been a shortage of medication in different parts of the country. It's a very dire situation. To an ordinary Botswana, it means they don't have money to buy those medications in private facilities. So to them, they will be hard done by such a situation, because if somebody doesn't have any money to buy, where would they go? There's nowhere to go. For them now, it may spell doom for them, or even death.
What we have been witnessing in the past was that there's been shortage of medication across public health facilities, be it your major hospitals or your clinics, which really affected the ordinary folk or public who rely much on the government for health and for their well-being.
The crisis has also been compounded by the withdrawal of U.S. aid. Botswana has until recently received significant aid payments for its health services from the United States, including around a third of the budget of its anti-HIV programs. Botswana are concerned about this situation.
Most of the people that are taking medication, like for the seizures, the epilepsies, they rely on government medication. So for them to have shortage of medication is going to trigger the conditions, which will deteriorate the health conditions.
It was a concern to me because I have two sisters that are in medication. One of them is in drinking HIV/AIDS medicine, the ARVs. The other one has a chronic disease.
I have actually experienced the shortage of medication. I am probably one of the few people in this country who actually suffers from low blood pressure. And it kind of becomes a problem when you're looking for like vitamin C, because we do need vitamin C, and it's not available in clinics.
It's a very critical thing because health is people's lives, right? We cannot have a structured economy if people are not well. Mentally, physically, if they're not okay, people are not going to function properly.
To tackle the growing crisis, the government has approved just over $18.7 million in emergency funding for medicine procurement. A national task force of experts has also been appointed to address availability of supplies across national distribution centers in the country.
It shall thereafter make recommendations for radical, world-class solutions to ensure that Botswana never finds herself in this position again. This national task force has already begun work. I emphasize that the work has been non-stop, and it will remain so until medicine reaches all the shelves in the country. The work shall remain non-stop until the entire value chain of procurement has been fixed, so that the beautiful people of this country can sleep peacefully at night.
The government says it hopes the emergency funding will help restore reliable access to vital medicines and prevent further strain on the health system. Yoli Sanjamela for CGTN in Johannesburg, South Africa.